Hi, everybody. This is Kara Thrasher Livingston with Senior and Disability Services Training, and I'd like to welcome you to our webinar here this afternoon, electronic visit verification, especially regarding updates for home health care. I'm going to offer a few housekeeping topics first up. You are accessing us through GoToWebinar, and you, as a participant, your audio is muted, and you want to look for ways to interact with us, which is specifically using the chat or questions area. So you should see on your taskbar, there should be a couple little buttons there or icons that you can open. That means you can open a text or chat area. It might say questions, it might say text, it might say chat. And that is how you're going to interact with us here today. You can give it a practice right now. If you would please go ahead and locate your questions area and just write to us something real quick. Give us a hello, good afternoon, and let me know that you can see this area and you know how to type into it. And everybody's doing a great job. I can see a whole bunch of hellos coming in. So hello to you. Welcome again. So other things to know is this will be about 1 hour. We'll have a presentation followed by Q&A. Again, you do want to feel free to submit your questions into the question area. You may receive answers by text back to you, and we'll also have some Q&A at the end and get all of our topics out there for folks to understand. There will be a recording available on our YouTube channel. Give us a little bit to get that up, probably by the end of the day today. By the way, SDS Training does have a YouTube channel, and it would be great if you could go to our YouTube channel at some point and like and subscribe to it, because that way you'll get notifications about when we have new videos. We usually do post our public-facing webinars, and a lot of our training videos are there too. Other things to know: if we have an internet connection break, or if you have an internet connection break, just please stay in the space, if you will, for at least a couple of minutes. It doesn't happen a whole lot, but sometimes our internet does get broken. If we disappear, stay in the space and we'll come right back. The way that you get back into the webinar, if you experience a problem like that, is just when you have internet connection again, just go back to your email and go back to your original link and then rejoin the webinar. We'll still be here for you. Likewise for us, if we happen to disappear, we'll be back momentarily. Okay, so that's just about it for our intros. Once again, welcome, and I would like to hand our presentation over to Lynn Kyleman-Cruz with Senior Disability Services. Go ahead, Lynn.
Thank you, Kara. Can you hear me okay? Yes. Thank you and welcome everyone. Thank you for coming to today's session. We appreciate your attendance. And a little bit about me: I am with Senior and Disability Services, and I'm the Chief of Quality here. So I oversee the project team that has been very much front and center with developing electronic visit verification, and has played a large part in all of this. We are responsible, the department is responsible for implementing and sharing the information with you today, but it touches several of our divisions. And so I'm here to represent Senior and Disability Services, which I will probably throughout the presentation refer to as SDS. And I also have Tracy Stevens here with me on behalf of Healthcare Services, and both of our teams are here. So when we get into question and answers, our teams are much more adept at being able to respond to technical questions and probably have more precise answers than I do. So thank you again for coming, and let's just get right into it. So today's outcome, the meeting outcomes that we hope to be able to impart upon you today, is the review of the whole system, or what electronic visit verification requirements are for home health services, and provide you information on our current state electronic visit verification vendor, and some provider options. Again, this webinar specifically is intended just for an overview. It's not really going to dive into too much technical information. We're going to review the project timelines and the milestones, and we'll continue to gather stakeholder feedback and answer questions. So just a little bit of history. The state began doing the stakeholder outreach in the March of 2018 regarding electronic visit verification. So we held information sessions around the state. It was really SDS leadership. I was a part of some of those discussions. And some of you may have attended some of those, and some of this information will be familiar to you, and others, this will be your first time hearing the information. So I'm hoping everyone will have the same understanding when we get to the end of the presentation. So why are we implementing electronic visit verification in Alaska? So the biggest thing you should know is that in December of 2016, Congress passed the Cures Act, and it basically, you can read here for yourself, says that any service like personal care service or home health services that requires an in-home visit by a provider must have an electronic visit verification system, which we will explain to you what that actually means. So the Cures Act required that all personal care related services had to be implemented by January 1st of 2020. We weren't ready, as were most states across the United States. So we were allowed to be granted a good faith effort, allowing extension until January of 2021. Senator Murkowski actually put that bill forward for us, and we were very thankful that we had the opportunity to extend that. The Cures Act also requires that home health services be delivered by January of 2023. So what happens if we don't comply with this? It results in a loss of federal Medicaid dollars for these types of services. So when we receive federal financial participation from the federal government, we usually pay a state share and the feds pay a federal share. Well, they will begin reducing the federal share that they pay for the service. And it begins at like 0.25% applied quarterly and increases yearly up to 1%. So we would end up paying more state share for our services and receive less federal dollars if we don't implement by 2023, January 1st of 2023. We were successful with personal care, and we had it stood up and implemented by the 2021 date. And we'll go over those timelines a little bit and give you a little bit more information about how we did that and sort of where we stand today. And again, if you have questions, please go ahead and put them in the question and answer box, and we will answer them as we go along or at the end. So what is electronic visit verification? It's pretty fairly simple, just like it says. It's electronically capturing a visit while staff is in the home providing the service. And we have several ways that we do that, and we will show you that in a future slide. But basically, that's the gist of it. It's just an electronic confirmation of the visit. What types of services must the system verify? So you can see here from this slide, there are six items. These are requirements. This is at minimum. This is what the federal Centers for Medicare and Medicaid, CMS, this is what they require an EVV system to collect. This is at minimum. So the type of service performed, the individual receiving the service, the date of the service, the location of the service delivery, the individual providing the service, and the time the service began and when it ended. So those are the 6 things that have to be done electronically. Um, So we will, we will have a little bit more information in later slides about other types of things that can be collected. So there are other options besides these 6 things, but we will have webinars that for providers later that will go into more detail about that. Right now, this is just an overview of the minimum standards that are required. So how do we collect the information? This is the part that sometimes is maybe the most confusing to people. So we have various ways to collect the information. One of the ways is called telephony, which is where a person has a landline. Who has those, right? Some people still have landlines. I don't personally, but it's a way for for someone to check in through their own landline at the recipient's home. So if you went in to do the visit, you could check in through their telephone. The other way is GPS enabled, and we do that through a smart device. So it's done at the beginning and the end of the visit. So this is the part that is very confusing to people, and I want to make sure that we touch on today. So this isn't like your fitness app where if I log into my run app at home, it'll show my house and then it logs my run for me and shows everywhere I have been all the way back to the time I log out of the app. This is not like that. This is our pinpoints, basically 2 pins in time. So it's really when I go into the visit, I'd log into the system, it drops a pin of that timestamp in the EVV system. And then when I'm done with the service, I check in again. It pins again at the end of the service and the location stamp. So it's really like a timestamp. It's not a tracking device. So I want to make sure people are aware of that. And then the next device is a fixed device, and it requires installation and removal. So it's not really a preferred method, either by the state, by the feds, or even by providers. And we have a few of those out there for places that they maybe don't have the other methods. And so those are the 4 types of ways that we have this and collect the information. What are the benefits of EVV? So, the federal government decided to enact this because there were several issues with the quality of care and the amount of fraud, waste, and abuse in services that are delivered in a home and not where other people can see what's happening. So we have quality of care issues. It provides a greater opportunity for data to support quality improvement and program efficiencies. It also gives you a real-time view of utilization and services provided. So it's meant to improve the quality of care for Medicaid recipients. And then the program integrity part of it is really reducing billing errors, as this says, reducing unauthorized services, and it validates that service delivery happened. So it also provides additional auditing tools. So both providers, the state, and the feds kind of know what's happening in real time. So some of our personal care providers that have implemented the tool are surprised. Some actually had implemented electronic visit verification prior to the Cures Act requiring it. And some of their feedback is that it allowed them to have a richer view into what was actually happening with their individual renderers. And so they felt more in control of their program. So those are some of the benefits of electronic visit verification. So some of the steps, again, going back a little bit of how we got to be here today, some of the steps the state took to decide sort of on how the EVV model, what EVV model we would choose. There were several options for us. And we went around again in 2018 and talked to community members, and we talked to providers, and we publicly listed these forums. And we received a lot of feedback. And what we found is that some systems, some providers already had systems in place. And when you implement a new system, it's not cheap normally. And so we really wanted to honor and respect that from a state level, that providers had the ability to have their own system, because many of them already did have their own system. And um, and figure out a way that we could do a little bit of both. So we once we had that sort of model figured out, we actually had to at Senior and Disability Services. This is where the project team sort of came in. Is we had to put out a request for information, a request for proposals. We had to select the vendor, and we had to go through quite a bit of feedback back and forth on what we really wanted to get. And then we had to get, of course, the appropriate funding approvals from the legislature and from the federal government. We awarded the contract for our selected vendor model to Therap Services, LLC. And one of the things to really note is that the selected provider that we have is, for those 6 elements, is free to providers. So this is the hybrid model. I sort of got ahead of myself with that slide. This is how we selected. So we selected Therap. And the one caveat that I will put in, that I will say here, is that when someone chooses their own system or they choose the state system, there are 2 systems. You could develop your own, or you could use the Therap model, state vendor selected model. But both systems have to be able to feed their information into an aggregator. So the aggregator, I will go over in the next slide, but all of that information has to be able to capture those 6 elements and feed it into this aggregator. So we call that a hybrid model because you can use either or. So the aggregator is really the element, it's the way, as you can see on the slide here, that the system information goes from any of our EVV systems around to the aggregator, and the aggregator sort of standardizes how the information flows in so that we're all doing it the same way. It reviews the data for required data elements to make sure that you have everything you need before a claim is submitted to MMIS. And then it exchanges, the aggregator sends information over to the Medicaid Management Information System. And it matches that, the EVV data matches the actual MMIS claim that came in. And if it doesn't match, we notify the provider on the reasons why it doesn't match. So it really standardizes the data from all systems that are out there using electronic visit verification. And again, this part of it is free to providers. So the data that is sent is near real time and at minimum daily from all the EVV systems. That's what the requirement is. So the state uses the data to report on required metrics to the Centers for Medicare and Medicaid, CMS, and with the Medicaid Management Information System for claims processing. This also gives providers a much better view into verifying that the service is being delivered, as I mentioned before. And I think providers are sometimes a little bit surprised by the level that they can see. It is a lot of work for all of us, but it is a valuable resource at the end. So how is the data used? This is where we have a requirement under the Cures Act to report to the federal government on key performance indicators. And these are the key performance indicators, sort of categories, if you will, of how we've developed measures that we report to CMS. It provides us with quality assurance that the services were delivered. And it also looks at claims validation to ensure that claims are paid for services delivered. And so it takes out a lot of the fraud, waste, and abuse that may have occurred prior to electronic visit verification implementation. I'm just looking at my notes to see if there's anything I missed. So they're structured around three major outcomes. So it's an enhanced ability to prevent fraud, waste, and abuse through increased visibility. I've already mentioned that. It also wants to know that the solution is reliable, accessible, and minimally burdensome on providers, beneficiaries, and their caregivers. So when we develop the system and when we look at what data is being used, these are the sort of the major premises for that. And that appropriate safeguards of electronic personal health information, protected health information, and PII information are implemented and maintained. So we want to make sure that we have all of those protections in place, that the system is reliable, accessible, minimally burdensome, and that we have an enhanced ability to prevent fraud, waste, and abuse from occurring. This is the timeline for our project. As I sort of already mentioned, if you look at under January 2021, that's when it was a requirement that EVV was implemented for personal care services. We did meet that requirement, and then for the 6 elements, we set that up, and all of our personal care providers were compliant and came forward and chose their model. And, you know, it was a lot of work to stand that up for personal care, but we did it by January 2021. So thank you to all those personal care providers that had to really be involved and engaged to get that happening. In June of 2021 is when we actually stood up the aggregator to allow all of those providers that were already using electronic visit verification to start sending their data over to the aggregator. And for us to cull that and sort of figure out what we had, it took us a bit of time to figure out how to make sure the data was crossing correctly. In October of 2021, we went through the system certification review, and this is where we had to answer a lot of questions and demonstrate the system to the Centers for Medicare and Medicaid, CMS, and their contractor to make sure that the system was operating correctly, that it was built as it was intended, that all of those other elements that we talked about, those 3 things, that it was working correctly in those 3 items, and that the reason that we try to certify a system like this is that then we get a little bit of enhanced funding from the federal government because we went through the certification process and it all works correctly. So they give you sort of a little bit of an added incentive to do this, to make sure that you're certified. In March of 2022, we started a prepayment claim review. So we would review claims and let providers know when we were not, you know, when something didn't match. So we could troubleshoot through that. And we're still troubleshooting. We're still sort of in what we would call a soft launch, as we also simultaneously are building for electronic visit verification for home health, which is due in January of 2023. So to talk more about the home health features or the issue, the requirements for home health, I'm going to turn it over to Tracy Stevens from Healthcare Services.
Thank you, Lynn, and good afternoon, everyone. So I am the Program Manager for Home Health Services with Division of Healthcare Services. And how we're preparing for the implementation of home health electronic visit verification is we've had state teams working together to identify which services are included under the home health care requirements for EVV. And we'll go over those services in just a moment. We're also updating regulations following the standard regulations process to include public comment periods. So just watch for those public comment periods. And if you would like to sign up to receive public comment period notifications, we can provide a link in a later slide. And then we're also doing outreach to stakeholders. And we're doing that just to continue to inform stakeholders and gather feedback. Okay. So here are the services known as the home health benefit. And CMS is equating home health care services as described in the 21st Century Cures Act with the long-standing home health benefit mentioned in Section 1905A7 of the Social Security Act. So the department worked to identify which services are included with home health care and electronic visit verification. And this chart defines the anticipated services. And you'll see that specialized private duty nursing services are on this chart as well. So those two at the bottom, these are waiver services that have been identified as meeting the home health care services requirements to be covered by EVV. And then in March, we issued a compliance notice letter to Alaska Medicaid home health care providers. And that letter is also posted on the Alaska Medicaid provider updates page, and it was included in the provider remittance advices. And with that, I'm gonna turn it back to you, Lynn.
And I can't get my cursor back to my right screen. Hold on just a second so I can advance my slides here. Not sure what's going on. Sorry. There we go. Whew. Complicated technology. Thanks, Tracy. So what's next for us? Several things. So again, as I said before, TheraP is the state EVV system that we chose and the state EVV aggregator. So that vendor will be hosting several informational webinars to review how the system works and how third-party systems can certify to connect to the aggregator. The state is asking providers to attend those webinars and register with TheraP with their intended EVV provider selection. This allows for proper planning for training and for providers and the certification process for third parties as we approach January of 2023. This is really important because it shows us your engagement and it allows us to provide more technical assistance, and it allows us to sort of understand the population that we're trying to assist here, which is all of you. And so those are upcoming webinars that are really important that you attend so you understand it, and then selecting your model for how you will participate in EVV is super important for you and for us. As Tracy mentioned, the regulations work has started. and it's following the standard process, so we can't really talk about that except that the public comment period will be open, and we will provide a link at the end of these slides. We have links with contact information and how to engage with us and how to engage in that public hearing process. We have a plan for user trainings and connections to the aggregator, so that's one of the things that we will work with you on. And then TheraP and the state conduct monthly town hall meetings regarding the system and to share information. So if you're not signed up or hooked into TheraP, it's a good way to start to gather, come to those monthly town halls. We go over a lot of information there, and hope to encourage, our questions, feedback, input with those. In this slide, you'll see that we have these upcoming webinars, May 20th and May 26th, for EVV with Alaska and the TheraP system. And it would be great if you register and attend those, as I said before. And once you register, you will get a confirmation email containing information about how to join the webinar itself. So you have to go here to register, and then you get the information for how to join the webinar. The best information or the best advice I can possibly give you as a person that's been here for a long time is to stay up to date. Follow us. Like Kara suggested, follow our YouTube channel. Jump in here to the state website on EVV to get more information. The other great thing, if you're not already a part of, is to sign up for our e-alerts. SDS, that's how we contact and communicate with our providers. And since our project team really oversees EVV, we will be sharing e-alerts on this project in particular through those e-alerts. So if you're not already there, please go in and sign up. You do not have to be a provider. You can be anyone and sign up for e-alerts, which keeps you informed, and information is good. The Alaska regulations to be able to go into the public notices, as Tracy talked about, is right here. So that's a link to get you there to be able to make public comment. You can also go to the federal government's website to see their Medicaid.com or .gov website, where they have additional information about electronic visit verification and maybe information about other states and what they're doing. And it's sometimes a little overwhelming to see all the information out there, but it's also a really good thing to look at. TheraP has their own Alaska webpage, and that we have included here. That will also give you a pretty good idea of all the work they're doing and what the system might look like. So I would recommend that as well. And then we have a very dedicated mailbox for EVV questions, answers, comments, and that is dhsseVV@alaska.gov. That's also where we like to keep questions streaming into there. So if you email Tracy or I, that would be great, but we might not respond as quickly as you would get if you go through the EVV mailbox. So I always recommend not that I don't want to hear from you, but go to the EVV mailbox because you'll get your answer faster, and it'll be from our technical teams that actually I don't have to go back to them to get the answer to give to you. They will answer the question. So that is really our presentation for today. And does anyone have questions that we may have not already covered in the chat or that you want to ask? I'm not seeing any coming in, but go ahead.
This is Jennifer. I was going to go ahead and just read some questions that we have in the chat, just in case folks don't see the answers in there, or we haven't answered them. We'll answer them as we go. So the first one is, will this reduce the number of audits that we are required to have going forward?
And the answer to that is probably no. Will it improve your audit outcomes going forward? Possibly. So we audits are required from a different source, so we don't have control over the types of audits that come your way, but you're having control over your program and having vision into your program. I believe it will help. I know. I think I could say this wholeheartedly. It will help the personal care providers that have already implemented with audits. And so I believe it will help you with audits. It won't eliminate audits.
Okay, thank you. And the next one is EVV going to be implemented for all home health care, home and community-based waiver services? And if not, do we have a timeline? So go ahead.
So at this time, it is not going to be implemented for home and community-based services, all home and community-based services. So the Cures Act it says that it has to be for personal care and home health type services. So just for folks on the phone to know that we recognize, so for instance, day habilitation is a waivered service. And in the course of day habilitation, if I'm the day hab worker, I may be assisting someone to use the restroom, which is more like a personal care type of service. However, it's not the intent of the service itself. It's ancillary. It's a sort of just something that occurred during the service. So we were able to go back to CMS for all the other services and say, look, these are the types of services we have. Even though they occur in the home, they don't look like personal care or home health. With specialized private duty nursing, when you look at the components of what occur in specialized private duty nursing, it looks like a home health visit. Therefore, it has to fall under the Cures Act. All other types of services that we deliver under home and community-based services at this time do not meet that intent of the language. And we don't have any other knowledge that CMS will be requiring that in the future at this point in time.
Thank you. Will these slides be emailed to those participating in this call?
We will post these slides on our YouTube channel. I'm not sure if we would email them all out. I think we would post them, and that's a good question. So I think they'll be posted publicly is how we would do that. I hope that works for folks. So like I said, to go to that YouTube channel, we could probably put that again in the chat. And
this is Kara. I'd be happy to put a channel link. And if you go there and like we said before, like and subscribe, then you'll get a notification when the recording goes up.
Perfect. Thank you, Kara.
Those are all our written questions at this time. If you haven't asked a question and you have one burning, please add it.
And if not, if something comes up later, comes to mind later, please go back to this slide and go to that EVV mailbox and feel free to email us with your burning questions as well. We're here to provide technical assistance and to assist making this this transition as smooth as possible.
And Lynn, we do have another question. The question is, are we doing away with paper timesheets this year?
That's always the burning question. Eventually, yes, this would be the keeper of the time. However, I will point out again, as I do to personal care providers, documentation of the service delivery in a note. The EVV, the 6 elements, do not contain what happened at the visit. And so those will need to keep occurring. Hope I answered that correctly. Jen or Lotta, would you have anything to add to that?
I don't think so, and that's still a topic for discussion within our town halls and our provider group. We know that that's something that's we would like to go paperless, but we want to make sure that that providers have the ability to document the required services delivered to meet requirements for billing, for claiming. So we're still working on that. Again, those are the enhancements to EVV.
Mm-hmm. I would go the next step also to say that it's an odd thing, at least for personal care services in the past, where we had the timesheet and the documentation of the service in the same document. That, you know, I'm a recreation therapist. That never happened in my role of documenting a service. My timesheet was completely separate. Even when I had, you know, 15-minute billing items, my documentation of my time was different than documentation of the service delivery. So the fact that we've coupled that for years in these particular services makes it hard to extricate that at this time. And so that's why we're trying to be careful. We're not trying to be cagey. We're trying to be careful to make sure that the service is also documented and the time is documented. So EVV helps with that, but it doesn't answer everything. Do we have any other questions coming in?
So there's a question of, if we already have done away with paper timesheets and only document on TheraP, should we start doing paper timesheets again?
If you have a way to document notes and the what occurred during the service, and you have a way to document time, then I would say no, don't go backwards to paper. However, it would be something that might warrant a conversation with the team here, just to make sure that your bases are covered if you haven't already done that.
Do we have any more questions? Can the clinical notes and the tasks be included in EVV in the future?
Those are some of the options that the state's EVV system is not providing at this time, but that you may explore with your selected EVV model. So I hope I answered that question fully, but it is something that some you know, as the prior question pointed out, some individuals have been using this, and they have an electronic way to capture both documentation and time, and that is a possibility for some systems, and so it's not out of the realm of possibility for you either. But it is not something that our current state selected vendor, that what the state has provided, it is not something that we have provided through TheraP. Any other questions? If not, I think we can end, and thank you again so much for everyone's time and attention today. And again, stay informed, stay up to date, follow those links that we provided in that that last slide, and you will be well on your way to getting this implemented. This slide. This is where we're going to update you with information, and where you can also comment publicly. And the EVV mailbox is the one at the bottom. If you have any questions, please reach out to us. We're here for you. And I think we'll go ahead and end the call. Kara?
Thanks, Lynn and team. Sure, we can go ahead and end. Those of us in attendance, you can go ahead and click out, and we'll stop the actual webinar in just a second here. And thanks again for comments coming in saying thank you for the presentation, and it was very informative. Okay, thanks everybody. Have a great afternoon. Goodbye.
Thank you. Bye-bye.